As the government rushes to stem the spread of COVID-19 in the country, it is now evident that the next 2 weeks will be a make or break for the country in the fight against the pandemic.
Our actions this coming week in particular will determine whether we shall go into a full-blown crisis with grave human economic consequences, or whether we shall limit the adverse impacts of this disease.
Health experts saying that an observation of countries that reported cases ahead of Kenya noted an increase in the number of infections after 2 weeks of confirming the cases. One such country being Italy, that reported its first 2 cases on 31st of January. A week later, an Italian man with a travel history to Wuhan tested positive for the virus. Thereafter, a cluster of cases were later detected. 16 cases were reported in Lombardy on 21st February, plus 60 more, and first death reported on 22nd February. By the beginning of March, the virus had spread across all regions of Italy that now has 41,035 cases and a total of 3,405 deaths.
Week 2 is the most critical week because it takes about 3 to 7 days for you to become symptomatic on average. And when you are symptomatic, that is when you start having a cough, a difficulty in breathing, a shortness of breath, and it is during that time that you have maximal viral shedding and therefore increased risk of transmission. And with the increased risk of transmission, of course, the caseload will increase.
And in a bid to secure Kenya's future and containing the virus, the government has introduced a new raft of measures, including the suspension of operations for bars and nightclubs past 7:30 p.m. Meanwhile, supermarkets will also have to control the number of customers in their stores in a bid to ensure they promote social distancing to combat infections among their customers, with preference being given to the elderly, expectant mothers and people living with disability.
In shopping areas are directed to determine the number of shoppers inside based on the size of their premises. Our queue management system must be established to manage the crowds outside the supermarket, with preference given to the elderly, expectant mothers, and people living with disabilities.
Kenya now joins other countries in introducing such measures, like in the United Kingdom, London, which directed its citizens to shop in shifts in a bid to control the number of shoppers in their stores.
Yeah, when the old people finish, 8 o'clock, the people going up.
The new raft of measures now also touch on the transport sector, where public service vehicles will now have to carry lesser number of passengers.
14-seater matatus will carry a maximum of 8 passengers. 25-seater vehicles, a maximum of 15 passengers. 30-seater vehicles and above to maintain a 60% maximum of seating capacity. This similarly applies for SGR and commuter train services.
Meanwhile, Kagwe has also called on employers to consider sending some of their staff on leave in a bid to conform to the 1 meter apart social distance. This, even as plans are underway to clean and disinfect Gikomba Market on Saturday in a bid to tame the spread. Gloria Milimu, K24 TV.